So I want to thank you all for coming in for lymphatic drainage massage. I have a couple things I want to talk about. I didn't make any notes, so again, you'll hear me babbling today. But again, thank you for coming in to Listening Hands for lymphatic drainage massage. Okay, this is the thing with lymphatic drainage. You are doing this because you've had a surgery and you don't want the fluid to build up. You don't want a seroma, the fluid under the skin. You don't want excess swelling, and you want to heal properly. These are the reasons why we're doing lymphatic drainage massage. You can also get lymphatic drainage massage even if you haven't had surgery. It helps with moving the lymph fluid so you don't have the excess swelling. Some people have conditions where they just develop the swelling of the fluid in their legs or in their arms, and other people do it for weight loss. A lot of stuff hasn't been scientifically proven, but a lot of people do experience weight loss, increased metabolism, things like that when they do lymphatic drainage massage. So for one, I want to thank you for coming here. Y'all have been coming in fine. Some of you have had procedures, some of you haven't, and it does not matter. Do whatever makes you feel beautiful. But I appreciate you coming here because, for one, I am a registered nurse. I'm also a licensed massage therapist. Okay, so this makes a difference. There are a lot of places that do lymphatic drainage and post-surgical procedures that aren't licensed, and they're not healthcare, which that's fine. I think that they do a good job. They've been trained, they've been certified. I haven't been there, but I feel like they do a good job, you know, in good faith. But there is still a difference. You have nurses out here who have places that do post-surgical care. You want to go to somebody who has actually worked with patients before they decided to open a lymphatic drainage business. Like, it just only makes sense. And then secondly, so there's nurses that have post-surgical businesses, so you can look for them. But there are also massage therapists who do post-surgical massage. You want to look for them as well. And then there's people like me who are registered nurses and also licensed massage therapists who do the post-surgical massage work. So there's a difference because we are trained, nurses are trained medically. So when I was in the hospital, I worked post-anesthesia care unit, which means immediately after surgery, when you're still under anesthesia, you come to me and I help you wake up. I check all your dressings, you know, making sure everything looks good, nothing's bleeding, all that good stuff. Very, very serious work to make sure you wake up and you're breathing well and make sure that, you know, all the incisions look good. So that's a different level of care already. And then as a licensed massage therapist, I'm lymphatic drainage massage. It's a massage. So technically it's a massage procedure. We should have a license for massage technically. I don't know what's going to happen in the future. I don't care what happens because I have my licenses. I have two. But for those people who are doing this type of work and they're not a massage therapist or healthcare, I don't know what's going to happen in the future. But if you care about the level of care that you're receiving, then you have options. You can come here, and a lot of you have been coming, and I really appreciate that. I think you're finding me on Google, which is beautiful. The only way to get a massage here as a new client is to book a specialty massage. So lymphatic drainage, prenatal, Himalayan salt, crystal body therapy, those type of things. Or you have to book a package. If you are not a specialty massage client, you have to book a package. And that is because Listening Hands is holistic care. It's healthcare. It's a heightened experience. It's elevation. You know, it's not just I am celebrating. You most certainly can come here to celebrate, but you need to understand that this is holistic care, and that is the reason why I do it like that. I only will take a new massage client who is dedicated to, you know, a plan of care, a holistic plan, so that we can make sure you're getting adequate care for whatever issue you have. But if you want to book a specialty massage, we can work, or you can book something, a different service like Reiki or reflexology, any of those things, and then you will be considered a client, and you can choose any service after that. But you know, here I don't take people who call and say I'm trying to get a massage in the next hour. I just don't, because this is a different level of care, and I need the clients to come who are ready for a heightened level of care, which includes consistency and responsibility in, you know, the type of care that you're doing for yourself. So self-care, not a one-time thing every 10 years you just decide, I want to treat myself. This is not what that is. But when people call, I do make recommendations. There's a lot of places that would love to have you if you are just, you know, waking up and want a massage and it's not something that you consider to be healthcare. That's just not what we do here. The other thing is, I've updated the website. So I'm always updating the website, probably daily or weekly. But a lot of people could not see all of the products because they didn't realize that it was a sliding gallery when you hit shop. They thought that you just scroll down and that's it. So if you just scroll down and that's it, you probably only saw 20 products. There's hundreds of products on my website. So now you can see them all. You can just scroll and see them, and then it's gonna say load more for each category. So you would hit load more. And then for crystals, there's a whole nother page with, I forget how many I have, but all of them are here in the office and they're all on the website. And the majority, most of them have a description, but some of them are new, so I'm still updating. So yeah, and they're here. So if you want to shop in office, you can come in. If you are somewhere else, we ship, but everything that's on the website is here. You don't have to wait for me to order it in order to get it to you. We have all of this stuff in stock, okay? What else? We have an eBay store. We kind of have an Amazon store. We had it, but then, you know, I'm so busy, I didn't have time to update all of it. But the Amazon store will be coming back very, very soon, probably in the next couple of weeks, where you can see what we have on Amazon. What else? There was something else I wanted to talk about. I forgot. But anyway, the biggest thing is thank you for coming in for the lymphatic massage, because a lot of people don't know that I do that. And yes, I do. It's a beautiful experience. I do a lot of different things when I massage. So when I massage, it's not just massage, even lymphatic drainage. I am speaking to your body, girl. I'm telling your body, you are going to heal, and you know, we are moving all this stuff out. So it is lymphatic drainage, it is spiritual healing, it is energy healing. We're using essential oils. We are using pain relief oils. We are using hot towels on your feet. You know, it's an experience. It's not just you sitting up and me rubbing your surgical areas. Of course, we're gonna do that. That's a large part of it. That's what you come for, but everything here is an experience. It's a heightened experience. Hi, I don't know how to say your name. Camille, I think. Hi, Camille. But yes, thank you for being here. I have a little time before my client gets here, so I thought I'd jump on in and say some things. And also with the lymphatic drainage, you have packages. So if you hit the self-care packages tab, there's packages so that you can save even more money. And ladies, if you are getting these procedures before I close out, I know I'm all over the place, but if you are getting these procedures, your procedure costs you a whole lot of money, my love. So you have to understand that your follow-up care and your post-surgical care is probably going to be a pretty penny as well. Now you could skip lymphatic drainage, you could skip all of that and just sit at home and potentially swell. A lot of doctors recommend lymphatic drainage, they swear by it. A lot of other doctors just say, oh, 6 weeks to heal and you'll be fine. And then you're wondering why you're puffy. So if your doctor did not tell you to get lymphatic drainage massages, you need them. Okay, I've worked with a lot of doctors, a lot of physicians, and you have a lot of female doctors who swear by it. Some men too, but it's usually the ladies that are like, you must do the massages after, and then the men are like, oh, you'll heal, you'll be fine. Not meaning to sound sexist, but that's the way it goes. But you do need these massages. So if your procedure costs you thousands of dollars, understand that you also need to set aside some money for your post-surgical care, because this is an investment, and you don't need to think that it's all done once you have surgery. Every surgery has post-op care. So for these body procedures, you need post-op care, or you're going to be in a situation. I said I worked on both sides of the coin. I worked right out of surgery. I also saw a whole lot of surgeries coming back in the emergency room when things are not healing properly, and you got pus coming out, and you got necrotic skin, and you have the wound dehiscing and opening up. All of these things coming back into the emergency room, I've worked with that too. And that's from the fact that you probably saved up a lot of money to get this procedure, and then you're like, can't believe I did it, I'm done with my procedure. And then your post-surgical care is non-existent, or it's either spacey. You're doing some post-surgical care once a month, you get a lymphatic drainage massage once a month. It's not supposed to be like that. You're really supposed to get them very, very frequently, at least a week apart when you come out of surgery. A lot of people say every other day. So if you look at the cost, you're almost paying for your surgery. The cost is up there, but it's worth it. You at least need to do it weekly when you come out of surgery. You can't do it once and say, this has cleared all my lymphatic drainage. So just thought I'd say that. But anyway, let me get off. My client will be here in a few minutes. Thank you for being here, and talk to you soon.